Hello and welcome. It is National Doctors Day. Our frontline workers, those who have been there at the forefront of this challenge that has gripped the entire world. It has taken everybody by surprise, and technically, ladies and gentlemen, it's a reset. In 100 years, we've not faced a pandemic like this. We've not faced a virus like this, which continues to change form, shape, and also in the way it manifests itself in people. And for people who have set aside their loved ones and then stayed true to the Hippocratic Oath and come forth and helped people out, saved lives, and fought in such adversity. It is a day to salute them. It is the National Doctors Day. And today, over the course of the next half an hour, we will talk to 4 or 5 people who, in their own way, have helped, who, in their own way, have worked with doctors, are doctors, and have also gone ahead and helped people at large. As part of the Sanjeevani campaign, this is a special effort to salute our doctors. Let's go straight across without much further ado to our guest in this very special effort. I've got Mr. Rajanarayanan, who's the zonal head of Bangalore of Federal Bank, and he's COVID recovered himself. Not an extreme case, but he has also seen those. I think, like all of us, who have lost near and dear ones. And imagine in the face of this challenge, when we talk to doctors and frontline workers who are seeing death all around them, and then they're also having to face it with their own loved ones, not being able to meet them, and also then having to deal with cases with people close to them. Dr. Rajendra Bharud, he's the district magistrate Nandurbar, a case in point, an example, a shining example where if you are able to think properly and use some foresight and plan in advance, then you can be ready to meet the challenges. And that's what they did in Nandurbar and in the neighboring regions. And what he has been able to do is also a template, a shining example of how caseloads can be dealt with and the sudden surge in cases can be dealt with. And that could not have been done had it not been for an efficient team of doctors also in place. So you give them, you equip them, then they'll be able to deliver better. Dr. M S Kanwar is a senior consultant, Department of Pulmonary Critical Care and Sleep Medicine, Indraprastha Apollo Hospital, Delhi. He's also written a book on COVID-19, and he's also involved in an in-depth research or a dipstick for at large, but quite in-depth as far as the Apollo Hospital Delhi is concerned, where they worked with healthcare workers and looked at the effect of vaccination, how important it is to get that jab, and how it technically and truly is a shot of life, because your mortality, the severity of how COVID-19 would impact you comes down drastically if you get the jab. And that's what their research proves. We'll talk about that too. And Dr. Chatterjee, senior consultant internal medicine in the Hospital, is also with us. Someone who's been an active proponent of taking the jab and also has been at the forefront and dealt with many cases. First up, it is your day. It is a celebration of doctors and the entire medical profession. Thank you very, very much for your service, and it's very, very nice to be able to speak to you. But I want to start with Dr. Rajendra Bharud. Dr. Rajendra Bharud, an area like Nandurbar, can you tell our viewers what you were able to do and how you, along with the medical team at your disposal, were able to counter the spread of COVID-19? How tough, how challenging it's been?
Well, Nandurbar district has population of more than 2 millions, and many districts, many blocks having very less infrastructure in the initial setup. So we were facing the crisis problems. Only two MD medicine doctor in the government setup. It's a hilly terrain area, difficult in terms of communication. So one thing I realized, despite of so many caseload, so many problems, doctors never give up. Paramedical staff, nurses, BAMS doctor, BHMS doctor, we trained them. And I think because of it's their combined effort, dedicated work, Nandurbar drastically reduced the caseload just in the matter of 2 weeks by 75%. And since last 1 month, we are getting case in single digits. So I think putting the plants or purchasing the ambulance, it's a completely different issue. But most importantly, other than the infrastructure, other than the material, what requires is the willpower and dedication of doctors. And I think in Nandurbar, I am quite lucky to have this company or the team of such a wonderful and dedicated doctors. In fact, one of the doctor who lost his wife in cancer, but he was the in charge of our COVID hospital duty. So, despite of the personal loss, he immediately joined in 2 days. There are many examples like this. One of the Asha worker who lost her husband and son both in the COVID, and I was visiting, still she was giving vaccination, she was doing the work of vaccination with smiling face. Of course, it's a personal loss to lose son and husband in the COVID pandemic. One of our block development officer, the lady and her son both died in the COVID. So there are so many heroes who, we can't even express our gratitude in terms of their work. But I realized because my field team was working day and night, they had put aside their personal grief and they were giving their best. That was the reason we were able to deal the COVID. So I really feel, they have given their best, and we should really salute on this platform to their wonderful work.
No, you very rightly said, and I think a lot of them have battled personal loss, and it's also very tough mentally. And Dr. Cover, it must not have been easy, not just as a senior doctor, but also as somebody who has many other people reporting, who also have family. How do you manage? How was it personally for you and for the team there at Indraprastha Apollo?
Anand, we had a tough time in the beginning trying to segregate the COVID and non-COVID patients. We didn't want them to get mixed up in any way. And we used to have board meetings, about 3 times a day. Chatty here, Suranjit,
Hmm.
was a part of that from the internal medicine group. So we had in critical care team, the internal medicine team. Then we got anesthesia into it, and then when the workload increased in the second wave, we had cardiologists, oncologists, surgeons join us because we couldn't cope up with the workload. It was a novel disease, and the unpredictability was so much that we were not sure, what would be the fate of the people who were initially involved with the patient care, nurses, the doctors. And I have a huge respect for the nurses and the doctors who were dealing with the patients, putting in tubes, putting in endotracheal tubes, and touching the patient all the time, putting in lines, because they were in very close contact. And we, at that time, in the early days, did not know how many of us, how many of them would eventually be on the bed getting treated ourselves. I got, Saranjit here got sick with COVID. A little later, I got sick with COVID. I was on oxygen for a week. And 10 days, Suranjit was in the hospital for, I think, a couple of weeks. I was in the hospital. So the moment we became negative, became asymptomatic, I was on the job again and seeing the patients and doing the rounds in the PPEs and in the summer times. It was a very hard time. But when we look back, I feel if I have to do it again, I'll certainly be there. And the spirits are high, and there was fear and frustration among people, the families, the patients. They were really they were scared to death, and we had to explain to them, though we didn't know whether we'll be able to save the patient, but we always kept the spirits high. And the families back home, now they didn't have any access to the patient. I mean, they were not allowed to come into the COVID wards, of course. So the only channel was through the telephones. But in the ICU, while we were caring for all the ICU cases, not a day passed, not a Sunday passed when I did not speak, and all of my other colleagues who were looking after the ICU, they did not speak to each family member every day while we were on the bedside. And we in our hospital had a practice of seeing the patient on the bedside every day, besides, of course, our team which was there around the clock inside the units.
No, absolutely. And one can only understand, one can't even begin to understand the gamut or the extent of the challenge. See, as a district magistrate, you are talking as an administrator, Dr. Barud, Surajit Chatterjee, Dr. Kavar, Rajanarayanji. All of us were, in our own professions, were dealing with it differently. But the doctor fraternity or the medical care fraternity were dealing with it day in, day out, at all points in time. If they save a life, then it was to their credit. And if they couldn't save a life, again the ire of the loved ones of the family would fall back upon upon the doctor. They're also human beings. Dr. Surajit Chatterjee, did you have trouble dealing with it? How often did you see your family when you had COVID? How did you deal with it? You also suffered. And at that time, all your medical knowledge, did it help? Or did you also say, I myself don't know what to do?
Absolutely, you're right. I had COVID in the early days, in the wave one. I had COVID in the month of May. And when I had it, two of our other colleagues also had it. And there was a huge discussion in the hospital as to how to, if something happens to them, how to go ahead with it. Because we had discussions with everybody, remdesivir and all that, because that time the wonder drug was not available in this country. We had discussions that we could get it from Bangladesh, where somebody spoke with the Gilead's vice president and said, no, Bangladesh doesn't have the real the remdesivir. You can get it from the research tool or something like that. He could be a research subject if he becomes sick. So there was a huge discussion. People were not confident that if something wrong happens, how to save me and the other colleagues of mine. It was early days. Every night that I spent over there in the hospital was a nightmare, because every day I would think that I don't know how the next day would happen. So even being a doctor and who has been dealing with COVID extensively, even in the early days, there was always a fear factor. So I understand how the patients go through it. And it is almost like a punishment to be in a ward without any other relatives of yours visiting you, or even you don't see familiar faces. Even the nurses are always all wearing PPs. The colleagues of yours who are coming to examine you all wear PPs. You can't see their faces. So it is actually quite a nightmarish experience when you're there alone in the ward dealing with a disease, the outcome of which you don't know. And as a doctor, you know that there are no definite treatment modalities. Even at that time, the role of steroids and all these drugs was not really known. So it was like an open thing, like, oh, if something happens, what will do? If something happens, what will do? So it was an everyday feature. So now I realize what patients go through when they're alone in the COVID wards. And so many times we had to spend hours together just counseling them. A few would really break down. They would think that they would not be able to see their relatives again, and they would die in the ward. And they would obviously read from the newspapers and all these things that, and on the media, that even if they die, even the cremation is an issue. So they would discuss all these things. Quite a few people would start thinking negatively, and it was a huge task really for all of us to counsel them, to counsel the family members. And we have gone all through it. And then came the second wave. The second wave was devastating. That was really devastating. We never expected that we had to see such days when the patients who were requiring high flow oxygen, not being able to breathe, lying on their chest, and just talking to ourselves. The ICU beds was scarcity. Luckily, we didn't have an oxygen scarcity in our hospital, but beds were always an issue. Treating all these sick patients, counseling them, and the family members said, we have sent them to the top hospital of the country. Why are you not shifting them to the ICU? We have to tell them that we have more sick patients than them who have to be treated in the ICU. Unfortunately, we don't have beds. So every night, my junior colleagues and everybody would go around the ward, seeing that how the oxygen requirement is. 1 or 2 days, we had to also even reduce the oxygen level to some extent so that we don't fall short of oxygen. So that was also an experience as to what level we should keep the oxygen so that the patients don't suffer. So we went through all these things, and I hope that we don't have to face the problems that we faced during the second wave. It's really an experience for all of us, the entire doctors fraternity, I must say.
True, absolutely. It's like, one of my doctor friends said, imagine, you are in a dark room and you don't know where you're going to be attacked and how many are going to attack you. And all you have is a stethoscope to defend yourself. So that's what we feel sometimes. That's how, tough this whole challenge is, because you just don't know anything. You just don't know anything. And each individual, the virus actually behaves very, very differently. Rajanarayanji, your own experience, as an employee of Federal Bank and someone with Federal Bank, I believe even you had COVID. My family had COVID sometime soon after Diwali last time, and we thankfully did not have severe symptoms. But I had a very, very sane doctor who had actually suffered 25 days, 30 days himself. But he told me that, he says, Anand, if you're physically all right, if you're fit, and if you have this, you manage it. You've been able to catch it early, so you manage it like this. And if there is any deterioration, you let me know. Otherwise, treat it like any flu. in your head, you have to treat it like any flu. He says most of the issues are when you get into a psychosomatic round, and then you get into a mental spiral of negativity. A lot of the other things then start to catch up on you. You do the right thing, keep yourself active, and just take, don't do something too much. Just follow this basic medicine course, and touch wood, by in about 5 days, me and my wife, we were all right. Our kids recovered in one day. That's a different story. But what is your story? And did you reach out to doctors? How did doctors help you out? What has been your experience? You're on mute, I think.
Yeah, thanks, Anand. Actually, COVID was a little mild on me, thankfully. So that was in the first wave. Around about September, I and my wife got infected, and we had a consultation with a doctor at St. Martha's Hospital here at Bangalore. So when I spoke to her, the doctor was extremely kind enough to spend a lot of time with me, asking me about different, even the food habits that I was having during COVID. So she just told me, it looks like it is going to be mild for you. Don't worry about it. Don't have negative thoughts. Be positive always, and ensure that you're high on calcium and zinc. And that is all she said. And she said, please check your oxygen saturation continuously. Every day, please keep a table and mark it down on it. And if it is coming any time below 94, or if your temperature is above normal, more than 100, give me a call. Or if it is crossing 102, or if it is below 92, I want you to come to the hospital. Thankfully, both of us, my wife and I, did not have to go to the hospital at all. So it was pretty mild on us. But what I would like to narrate here is an experience that I had with one of my colleagues in the bank. So at Federal Bank, we had this COVID crisis management team, of which I was also a member. This was primarily to help our colleagues or our team members who were infected by COVID, whatever best ways we could. So one of our colleagues was infected with COVID, and he was admitted to a hospital, and he was in the ICU for a week's time. And his wife was staying away from him, and she wanted to have access to him, which of course she did not get. So she was continuously in touch with me and asking me about his improvement, what his condition is, and all that. So I was also a little, I was feeling totally helpless, other than to report back to her whatever I heard from the doctor. So I finally I sent out a plea to the doctor, asking him whether I could come and meet my colleague there. So he said, okay, but you should take all precautions. This is the COVID ICU. So you need to come with all precautions to the hospital. So I was with a lot of precautions. I went to the hospital, went into the COVID ward, and that was when the entire scenario took me by surprise. There were two young doctors who were running around, and there were, I think, 8 beds there, if I remember correctly. And at least 3 or 4 patients were, panting and gasping for breath. And these doctors were running around, putting on the oxygen supply and helping them, telling them, soothing them. They were actually, I did not expect that part of the doctor's role was to speak to the speak to the patient. So these doctors were speaking very, very softly and trying to soothe them. So that took me by surprise, and I went and met my own colleague who was in a very, very bad situation. So I spoke to him for a few minutes. I was not allowed to be there for more than 5 minutes. And I spent those 5 minutes with him, and it was, later on my colleague passed away. But it was those five minutes was, I think, could give him a lot of solace. And after I came back, I spoke to his wife and passed on his words to her. And that was the time I knew how dependent and how totally reliant on the healthcare industry the normal people were. Thanks to the great work done by our healthcare industry, doctors, nurses, and everybody who's there. This is outstanding work actually that they have done. So that's what I would like to say.
A lot of us fail to realize that these are individual cases. Right. So if one case like this can affect us so much, imagine what the likes of Dr. Bharud or Dr. Kanwar and Dr. Chatterjee and so many other doctors and healthcare workers and administrators have to go through, because you are dealing with so many cases every day. You are seeing this all around you. How difficult or easy has it been, Dr. Bharud, to stay in with the task and to keep yourself mentally positive? It's so important. and it can get you. I know it very well. Just walking into a COVID ward or seeing the visuals can depress you. We've lost colleagues. I've lost colleagues here at Network 18. It's painful. We may not know them very well, but it's painful. And some of them we know, but it's painful. So how did you deal with it? And what do doctors and administrators like you tell yourself here? Please share that with us, because how are you guys able to remain positive?
True. Currently in Nandurbar, as you said rightly, one thing I want to highlight here, because it's a tribal dominated district in Nandurbar. Around 75% population is tribal. And when somebody who is a poor person, he can't afford private hospital treatment. Let's say, the private bills were in the lakhs. So somebody who is just a daily wage worker, he can't go to the private hospital. As I said in the last time, we started with the 20-bedded government hospital because government beds are already occupied for other treatment also. Slowly, we have to increase the oxygen ICU bed to more than 700. But sometimes, at one point, all the beds are occupied, and we can't deny the patient. Yeah, you came here, beds are occupied. So I said, okay, no issue. Keep him on the floor, put the patient, put jumbo cylinder aside, but we can't deny anybody. That was the situation. And it was really horrible. I went to that hospital. I saw entire hall, outside doors. People were there. Relative was aside, putting the cylinder. My help people were working on that. But again, that was the situation. That was the demand, because we can't create beds in unlimited numbers. We can't just put on oxygen line unlimitedly, because unless and until there is a match of demand and gap, we can't give bed to everybody. But fortunately, that thing lasted only for 3-4 days. Immediately, caseload was reduced, and by the grace, everyone later on getting the beds. There was no complaint about the beds. But I think mostly in the metropolitan cities, that was the issue, specifically for those who are very poor and those who can't afford money. So I think being a government bureaucrat, I really feel there are certain times which is thankless time, where we just have to, give thanks to our doctors and nurses. They work day and night there, and because of that, thousands of lives were saved, at least in my district.
No, true. And especially in the second wave, you saw a lot of people panicking, and they were coming and occupying beds in hospitals. And how do you deal with it, Dr. Kanwar? How do you deal with patients? Because everybody sees it from their point of view. Nobody sees it from a larger point of view at that point in time. Nobody says that the other person needs it more. There are very few people who do it. I remember the story of an 84-year-old from Nagpur who actually said that, no, give my bed to a 40-year-old father of two, because I have lived my life, and he has still got a huge 4 decades at least ahead of him, and his family is dependent on him. Give that bed. बहुत कम लोग ऐसा करते हैं. And then it can get to you. How did you guys deal with it?
Very interesting question, because this was a real problem. There was a stage in the second epidemic. Sorry, this wave. We had about, at one point, about 30 patients who were on high flow oxygen, who should have been in the ICU, but the ICU was full, and none of the patients could be shifted out. And we didn't know how to manage them in the wards, and the FDUs were full. So we were doing the job of the ICU in the wards without the support of the ICU, without the ventilators around, without even the machines like BiPAP and AVAPs, those A40s. We didn't have those things, which I'm used to using in ICU all the time. So now we were treating those patients. At the same time, when I moved from during my round to another unit, I find patients sitting there chatting on the phone and or playing with their mobile. They were there in the hospital just because they wanted to escape from the family, so that they don't infect the family members. They were just occupying the bed in the hospital. Now we wanted to convince them. We tried to convince them that they would get the influence from somewhere to keep the patient there for a few more days. So these were the situations. And at the same time, there was a time when our waiting list went up to almost 1,000. Anand, you would believe that. almost 1,000 for a few days. And our own relatives, I wanted to get them in. I couldn't get them in. And Soranjit would know that. There were so many other consultants who were talking, this was a talking point, that we can't get our relatives in. At the same time, there were quite a few patients who should have been at their homes, but they were occupying the beds. And the patients who were very sick, there were patients at one time in the ambulance, brought oxygen cylinder from their homes. Now they are sitting in the car or ambulance, their personal car, outside our emergency, and they just wanted a bed inside. Their cylinder would finish over after a few hours. So our hospital was filling up those cylinders and asking to stay put in the car until a bed is ready. Sometimes it wouldn't happen. And they would try for other hospitals at the same time. There was a time when my patients went to Jajjar, went to Karnal, went to Chandigarh, Panipat, and in Meerut to get a bed. And I was treating them from here. Patients were in ICUs, in small ICUs somewhere in UP or Haryana, and I would be giving them treatment and helping the doctors there who were not so experienced to keep them alive and to do the best for them. I mean, the situation was so terrible. Never thought I would see this kind of situation in 46 years of my medical practice. We would be in a situation where we feel so helpless for our own relatives. And there was not a family in India, in urban India at least, who did not lose a near or a distant relative.
Yeah.
Of course, friends, yes.
No, I totally agree with you. And I know the story of a DM who actually did a round of the hospitals in their area, and they cleared in 3 hours, they cleared 250 beds. 250 beds, they cleared them of patients who were just sitting there occupying those beds. They should have been at home, but they just said, ki, bhai, agar kuch ho gaya to? And the DM had to be rude, and the DM had to be strict and had to say, look at these doctors, look at those patients there. They need it more than you. Where is your humanity? And they are saying, main to paise de raha hu. I'll pay double, but give me my bed. There were cases in urban India, Dr. Chatterjee, and I know the hospitals had been paid 10 days money in advance by people who said, just keep a bed free for me. So that's another part. And then you have the other side where you have to deal with patients who believe that you have not given them enough attention, despite the fact that you are actually treating 4 times, 5 times, 10 times the caseload that you normally handle. How did you personally deal with it?
I agree with Dr. Kanwar to all the statements that he made, but this time I saw a few good people as well. Means obviously there was one side of people who wanted to be in the hospital because of safety factor. They're very unsure of what would happen to them. They're very scared as to what will happen to them. And obviously the third thing was that they would infect people or elderly people who are there with them. But then people that I saw a few rich of this city being admitted to the hospital and who told us that keep us in a room, keep us in a shared room so that more number of beds, more number of patients can be brought in. So this was a good gesture from their side. So we have both the sides of the coin. One who wanted to have all the luxuries of the hospital and who wanted to stay in the, but I would also say that quite a few of them were actually scared to stay at home, that they would lose their life. They would, all young people, and this time in the second wave especially, we saw so many young people having COVID. But the other side was that the people who were eligible for suite rooms and all that, they said, oh, keep us in a room. You can keep 3 people in one room so that more number of patients can get into the hospital. The other thing that which really distressed us were all the patients who we have been treating for the last 15 years, 20 years, giving us a ring and telling us that, sir, this patient of yours is having an oxygen level of 60%, is staying at home. This patient has 2 kids who's 10 years of age, 12 years of age, and this patient would die. So that made us really distressed, because that is what Dr. Kanwar was telling us, that we couldn't help patients to get a bed, even deserving patients to get a bed in the hospital. And that was really distressing. I still remember one night, there was a colleague of mine who now works with Apollo Bhubaneswar. His brother was sick in Gurgaon. He gave a ring all night through, and with all those Moses folding his hands again and again, telling Chatterjee, you are there at Apollo Hospital. I am told that you are a big name now. Can't you give a bed to my brother who would die in the next couple of hours if you don't help him out. The entire night he went on pestering me from Bhubaneswar. I spoke with everybody and anybody in this hospital, couldn't arrange a bed just because there were no beds. This was not that he could not, because he was a junior doctor in this hospital earlier. His own brother was so sick. He went on pestering me. I went on requesting people, but I couldn't provide a bed. Till date, I feel so sorry for that doctor and for that patient who actually lost his life later on. So it is really distressing. When all this news came to us, it was really distressing that even being in a profession, we're in a situation where we can help out people for treating them, we couldn't do it. So I just hope that this doesn't happen again. And even if the third wave comes, even if it comes, it is a much milder variety. That's basically all wishful thinking.
Variety, or if we are able to get ourselves vaccinated, and I know administratively and also medically, a lot of you have also studied these aspects. So finally, we have paucity of time, so I'm just going to get one round of comments, and I'm going to start with Dr. Rajendra Bharud and then come back and we'll end with Rajanarayanan ji. But Dr. Bharud, what is your overall inference, learning, takeaway, which you would like to share with all our viewers? Working with doctors, working, in the time of a pandemic, working in a region which is largely tribal, and also a lot of people who don't even understand what's the big deal about this virus and what it can do to us internally.
I will like to share three things. Early preparedness. We should be prepared to whatever possible disaster that can come. Second thing, in this COVID, no one is boss, no one is junior. We should work as a team. Because everybody is so much stressed out, we just can't issue the orders without understanding the ground reality. And third thing, be practical. Be practical means we should not extend or we should not stretch our doctors or medical fraternity beyond certain limit. We should be understanding them as a human. They are human beings. They have their limits, and whatever the practical solution, like we had done the isolation center in every village, every school, every dharmshala. So around 5,000 beds were created near the villages. We had hired the jeeps so that can be act as ambulances. So practical solutions at the ground level. These three things can really help as a bureaucrat to understand and deal the disaster like COVID. These are my learnings.
Very rightly said. Doctors are also human beings. Healthcare workers are also human beings, and they're also going beyond the call of duty. You can set up 5,000 beds, but if there are only 50 doctors to address those 5,000 beds, imagine the load on them. So and the pressure that they are taking as human beings. So Dr. Kanwar, what do you tell your team? What do you tell yourself, and what do you tell our viewers?
Let's see. We should be making ourselves. It should be very clear in our minds that if there is a third wave, we should be prepared for that. The administration, the Ministry of Health, they should not be dismantling the stuff that they prepared after the first wave, and they were totally found unawares and unprepared when the second wave came in. Now the third wave with Delta Plus or 1.282 B1.282 is another one lurking around, and there are other mutations which are difficult to handle, like N417K. Now, if there is a third wave, my personal belief is, and I have reasons for that to believe, that it would be milder and it would be more spaced out. It would not go up like a rocket, which took everybody by surprise, and we were not fully prepared for that. So it would be probably milder and would be handled much better because people have learned their lessons the second time around, and they would not be making those mistakes at the political level also.
Dr. Chatterjee, do you think the mental toughness has been tested? That the space between the years has been given a nice workup with the second wave, so people will be able to be a little more sane if there's an impending third wave, and how important is getting vaccinated?
Oh, it's absolutely mandatory that everybody gets vaccinated. If you don't vaccinate yourself, then you're in trouble. All these waves, all these mutations are not going to end them. If we have to end this pandemic, we have to take the vaccine. We have to follow all the precautionary steps that we have been talking about for the last 1.5 years. The media has been great. The government has been also pretty proactive in telling all the citizens of this country, but unfortunately, this has not been followed. So if we have to have vaccinations, we have to follow the COVID appropriate behavior, then only this pandemic can come to an end at in a couple of months. Otherwise, we are in for trouble with different mutations and different viruses and different waves. The other thing that I would definitely like to request is, see, the doctors, the administrators, the healthcare workers, nurses, housekeepers, everybody is trying their best in this pandemic situation. But we have seen a few times the ire of the relatives. They're coming and breaking the hospitals, beating up doctors. I would like to request, just don't test. The doctors are trying their best. The healthcare workers are trying their best. Even the administrators of the hospitals and of the countries are trying their best to treat this pandemic. So please don't end up bashing up breaking the hospital, bashing up doctors, because that really distresses us. That after working so much, after not seeing our families for days together, working 16 to 18 hours a day, and at the end, if somebody comes and blames you, then that is very distressing for all of us.
No, very rightly said. And then you're also disrupting treatment for other people. If losing somebody close to you can hurt you, yeah, one has to also think that you may also be causing somebody else losing their life because you're disrupting critical treatment. Some things are good, some things are bad, and it hurts. But the fact is that you have to look at the larger picture, and the larger picture is that there are only so many doctors, and there are only so many beds, and there are only so many healthcare workers, and the system is supposed to cater to only say 1% of the entire population caseload in the entire district on a given time. Suddenly, if it jumps to 10 to 15% or 20%, it's going to stress everybody out. We've got to work together, and in a lot of cases, I agree with you, Dr. Chatterjee. And getting the jab is important. And Rajanarayanji, one of the aspects and one of the things we are doing together here is spreading vaccine awareness. And I need to thank Federal Bank on behalf of Network 18 for partnering with us and helping us take the Sanjeevani program on ground. The Sanjeevani Gadi has gone to more than about 200 villages, 280 villages actually already, and the target is to cover more than 500 villages.
Yeah, so Sanjeevani has been a great program for us. We are also very proud to be associated with this program. And this vaccine advocacy that we've been practicing across several districts in the entire country, we are sure will deliver the right results for like the good doctor said earlier. I think it is increasing the percentage of vaccination that will protect us from the third wave. So vaccine advocacy it is, and Federal Bank is committed to it, and we are hoping that we'll be able to do much more good work in this area.
True, and as I wind up this engaging conversation, I can only say one thing. It's a humble request. Trust your doctor, respect your doctor, work with your doctor, and also realize that the doctor is also a human being. They are not superhuman, they are also human beings. So they also feel the same pain, they also feel the same emotion, and they also feel the same stress and the same tiredness that we would feel. But they are there, they're going beyond the call of duty to do it. And on National Doctors Day, let's all resolve that we'll work with them help us, and treat us. I thank you all. Thank you very, very much.